Bismillahirrahmanirrahim. Hello friends, this is Dr. Rashid from California. Today I am introducing you world's deadliest disease, heart problems. And my today's topic is heart attack. Before I start, I want to introduce a short introduction of Mr. Mike Ali. We are thankful to Mr. Mike Ali for his generous support and contribution to provide this valuable health information through this video, brochure, poster, and on our website. Mr. Mike Ali is a successful, well-known businessman, philanthropist, and a kind-hearted person. He is recovering from his surgery. Please pray for him for his well-being and fast recovery. My welfare guru, Malak Riaz, also advised me to continue this health awareness program on most common disease. So, heart attack, heart block, cardiac arrest, or MI or myocardial infarction is the name of same disease. So let's start from myocardial infarction. CVD is the deadliest disease of the world. Approximately 18 million people die every year due to the heart problems. That is 31% of total global death. In United States, more than 610,000 people die every year due to the CVD. Recent Google report. Almost every fourth death in the United States is due to the heart problem. That figure is higher in India because of its huge population, where every year about 7 to 8 million people die due to the CVD, and is also largest killer disease of India. Heart is a muscular organ about the size of fist, and its weight in men is 10.5 ounces and in women about 9 ounces. Heart is located in the mid of our chest and is protected by a rib cage. Heart is very powerful organ and pumps 80 gallons of blood every hour to our body non-stop to our whole life. What are the main causes of the heart? Smoking. Smoking is the number one cause. And because why I wrote the smoking is number one cause, when I was working in the cardiology department and some patients come with the heart attack, and when the doctor take the history, the doctor's first question from the patient is, are you smoker or non-smoker? So smoking is the number one cause of the heart disease. Number two, high cholesterol. LDA pattern B is a bad cholesterol. And number three, abdominal obesity, high blood pressure, stress. And in our brain there is a small bodies almost the size of almond on our back of our ear is called amygdala. Amygdala helps to protect the brain from the stress. And this amygdala controls our emotions, our decisions, and stress. If the amygdala is affected, then the stress rises, and that rise of stress can cause the heart attack. So please avoid this, the most important cause, one of the most important cause of the heart attack. Number five, diabetes. And most people have diabetes also from their genetics. If it is from the genetics, please be very careful. And some people have a genetics problem from the heart attack in their family. So those people also must be very, very careful about these things. So these are the main causes of the heart. Number one, smoking, high cholesterol, abdomen, obesity, high blood pressure, stress, that is caused by amygdala, diabetes, and genetics. Sometimes lack of exercise and abnormal imbalance of the hormones may cause heart attack. And now I am telling you that I told you about the smoking and the cholesterol. These are the most major important cause for the heart disease. So I am showing you the figure of this one is the figure of a non-smoker healthy person, and suppose 50 ml blood is flowing from this coronary artery, and other shows the coronary artery of an other person, the same blood amount 50 ml is passing from the artery. But here you see the nicotine is departed, debris, nicotine, some other matter. So this passage is narrow. And same thing here, 50 ml blood, the same amount, but here is also the passage is narrow. And these things are deposited here just like cholesterol, fatty deposits, some debris. So this figure and this figure is almost same. But if you look on the first figure, it is healthy person. Suppose the 50 ml blood is passing from here, it goes easily without any pressure. But the people who are taking the cigarettes and the high cholesterol, then this blood pressure push lot of power on the interior wall of the blood. That pressure of blood on lateral walls is called blood pressure. So in this coronary artery, the blood is pressing more on the lateral walls. So those people can be affected by high blood pressure and plus the heart attack. So this deposit, the fatty deposit and cholesterol deposit, or this deposit, the name is plaque, and the condition is called atherosclerosis. This is the most dangerous condition, so be very careful about the cholesterol and the smoking. These are the major killer of the heart attack. Now, how the heart attack occurs. So heart is also supplied by the arteries. These I am showing you the most important 4 arteries of the heart. They supply the blood to the heart. So these, on the left side, there's a left coronary artery, then left coronary artery further divided in the circumflex artery, and the left anterior descending artery, and on the right side it is right coronary artery. So these left and right artery arises from the biggest artery in our body is aorta. So when the blood, when these arteries are affected, and just like I told you here, then they block it. This plaque cause the heart attack. So this is the most important thing, most important arteries for the blood supply, and they causes the heart attack. All the problems of the heart attack mostly arises from this coronary artery. So you should be very careful to take care of about coronary arteries and make your heart healthy. Now, how you know that you have the heart problem? So I am telling you the signs and symptoms of the heart attack. So first important sign of the heart attack is the chest pain. You feel the discomfort, chest pain. Mostly pain radiates from the left arm, left shoulder to your left side of chest. Sometimes pain also radiates from your lower back side of head and also from jaw. Pain is so severe and crushing, producing a lot of people even feel like an elephant is sitting atop their chest. pain lasts more than 4 or 5 minutes. So chest pain is the number one cause of the sign and symptom of the heart. Number two, pain is so severe, even in the cold weather, your body sweats due to the pain. And when the patient come in the hospital, in the ward, and when the doctor touched the patient is cold and wet and sweating. So this is also the symptoms of one of the symptom of the heart. And number three is the shortness of breath. Heart is affected severely and cannot pumping blood out of a heart effectively to lungs, causing this problem, shortness of breath. And sometimes nausea and vomiting, sometimes nausea, sometimes vomiting, and sometimes both. And people also feel fatigue, tiredness, and dizziness. So save your life from heart attack, change your lifestyle can save you from the heart attack. Some of heart procedure that you don't want in your life. If you don't want these heart procedure in your life, then change your lifestyle. So first of all, I am telling you these are the most important tests and the procedures on the heart. Number one, we do the EKG or ECG, that is the electrocardiograph. That is the simplest that is good. After so when people have some problem, then doctor check their ECG before the exercise and after the exercise. It's okay. But these are very hard procedures. These are called angiography. Examination by X-ray of blood vessel carries out after introduction of a radio opaque substance. And angioplasty, surgical repair or unblocking of blood vessel. Stent, a tubular support placed inside a blood vessel to relieve obstruction. Pacemaker is a small device that is placed in the chest or abdomen to help control abdominal heart rhythm. Bypass, a surgical procedure to restore normal blood flow to an obstructed coronary artery, also called coronary artery bypass or bypass graft surgery. Open heart surgery. Open heart surgery isn't any type of surgery where the chest is cut open and surgery is performed on the muscles, valves, arteries of the heart. So I think nobody like these heart procedure in their bodies. So change your lifestyle, take a simple food, healthy food, exercise. Now I am coming to about the care and prevention, that how you can save from the heart attack, save your life from heart problems, change your lifestyle. Best advices that can make your life heart attack proof. Number one, stop smoking. Quit. If you are smoking, please quit. Quit the smoking from today. This is the most important cause of the heart attack. Number two, control your cholesterol. Check your cholesterol. If it is high, you should control your cholesterol. Number three, control your abdominal obesity. Lot of fat on your bellies may cause the heart problem. So control your fat on your belly. Number four, control your weight. Also cause the heart problem. Control your blood pressure, as I told you. So this is also the one of the most important cause of the heart attack. So control your blood pressure. Number six, no stress. Be happy and enjoy your life. I told you that keep your amygdala happy. If your amygdala is happy, you have no problem, then you can be away from the heart attack. So if you take care of these things, you will not see any heart attack or any heart problem in your life. So stop smoking, control your cholesterol, control your abdominal obesity, control your weight, control your blood pressure, and no stress in your life. Keep your amygdala happy. Avoid heavy foods, take healthy foods, no cholesterol, no oil. Change your eating habits. Use vegetables, fruits, including dry fruit like almonds, walnut, apricot, date palm. You can also take fish and chicken. I'm telling you the 12 best food to clean arteries that save your life from heart attacks. But please note these 12 important food that cleans your heart from the clot, from the debris, from the lot of things, and there will be no deposit of anything. So number 1 is broccoli, green tea, flax seeds, spinach, pomegranates, cranberries, avocados, asparagus, turmeric, apple, garlic, chia seeds. So these things are very, very important. Please note these things. If you follow these instructions, you will save your life. Please share my this program to your friends, your relatives, your sister, your brothers, and everybody. Hope I will meet you the next week. Thank you for listening. If you like it, please subscribe me. Thank you very much.